Assalamu alaikum, Mohammad Haisam here, final year veterinarian student at uvas from group evening A2. Today we will discuss about the case presentation of vaginal hyperplasia in bullmastiff bitch, and this case was published in May 2020, and the case was presented at University of Veterinary Technology Sciences. So uh, for the reference, I have added the bullmastiff dog picture here, and it's a brachycephalic breed. And let's dive into the case, and we will understand what the case was, what was the diagnosis, and what treatment they followed to treat the hyperplasia. So when they did the clinical evaluation, temperature was 40.4 degrees Celsius, pulse rate was slightly high, means 150 beats per minute, and when they look at the respiration, this was 48 breaths per minute, means respiration was also slightly high. When they look at the lungs pattern through stethoscope, so the lung patterns was normal, so it means there is no issue with the respiration or the heart. When they did the general examination, they look upon the lymph nodes, mainly the popliteal lymph nodes, which were slightly enlarged, slightly pale mucous membrane, as we have discussed it earlier. Upon the general examination of the body, ticks were present there, so there was the mainly history of the ticks. Upon the ultrasonography, there was no ovarian or uterine abnormalities, means there were no cyst or there was no neoplasic mass there. When they did the hormonal examination, hormone level, when they checked the hormone level, estradiol, which was slightly high, 22.9 picogram per milliliter, and the progesterone was also high. Also, they took the vaginal mass. For the further confirmation, they took the vaginal mass and performed the cultural exam there. So they have observed the Staphylococcus aureus bacteria there. Upon the hematological findings, they collect the blood sample and run the CBC over this complete blood report. When they looked upon the report, packed cell volume was decreased, hemoglobin concentration was decreased, and the RBC counts were also decreased. So means there is an anemic condition which was going on into the bullmastiff bitch. Upon the vaginal cytology, they looked at enucleated superficial cornified vaginal cells were there. When we said that enucleated vaginal cells were there, so means the animal is on heat or showing the signs of the estrus. Now we will go for the differential diagnosis. First of all, we will see the estral hypertrophy. In the estral hypertrophy, you will see the enlargement of the vulva and no ovarian masses are there. Second, we will go with ovarian cyst or the tumor. In ovarian cyst, you will see the persistent estrus, which means the estrogen level consistently increases there and the estrus is present there. And further, upon doing the ultrasonography, you will see the fluid filled mass over the ovaries, which could be 2 or greater than 2 centimeter there. Upon the vaginal neoplasia, if you look at the vaginal neoplasia, you will see the abnormal vaginal discharge, straining, animal is doing the straining. On the visual inspection, you will see there is a large mass, there will be the large mass in the vaginal neoplasia, and you will confirm this only by the biopsy. And lastly, the vaginal prolapse or the vaginal hyperplasia. So we go with this condition that animal was showing the sign of the vaginal hyperplasia. Type 3 vaginal hyperplasia, you will see the complete prolapse and complete circumference or the entire circumference of the vaginal wall will protrude out from the urethral orifice. Further histopathology was performed there, and they took the excised vaginal tissue and performed the histopathology there, and they see the hyperplasia of the stratified squamous epithelium. When the doctor discussed the condition to the client and the doctor suggests or advised the client to do the ovarian hysterectomy of the bitch, but the owner refused to do the ovarian hysterectomy because they want to preserve the fertility of the bitch. Medical procedure was performed there. They washed the vagina and scrubbed with 0.3% chlorhexidine gluconate solution, which is antiseptic solution. And to sedate the animal, they give the dose, which is, they give the general anesthesia, which is carketamine, atropine, and xylazine. Also, with the fluid therapy, ringal lactate solution they did there, and the urethral catheterization was done. As there was a tick history, so they performed the pyrethrin powder with the Elizabeth collar, so the animal will not leak over the body, otherwise animal will show the cholinergic signs. In the first post-op, they give the antibiotic, which was procaine penicillin, streptomycin, and benzyl penicillin, and synthetic opioid analgesic was also injected into the animal, which is tramadol HCl. A successful surgery was performed there. We will discuss about some other points as well. As I told, the owner want to preserve the fertility of the animal. Surgical excision were performed there. After the 14 days, patient were discharged, and the best part of this clinical presentation was that being so much difficult vaginal hyperplasia or the prolapse case, still the animal or the bitch bred successfully after 27 weeks of the post surgery. So this was the case I presented here. Thank you.